sore, cracked, damaged, bleeding nipples. Ouch! I want you to know that cracked, damaged nipples are never normal. Tenderness and soreness in the first few days after delivery is normal. Having some discomfort while trying to perfect your latch can be normal, but damage is not normal for breastfeeding. It usually means something is wrong. Either you have a shallow latch with your baby from positioning, there is an undiagnosed tongue tie, or you might have the wrong size pump flange or a poor quality pump that's causing that pain and damage. If you're having any damage to your breast, please make sure to reach out to an IBCLC lactation consultant to figure out why you're having damage, especially if it's ongoing or happening multiple times in the course of your journey. But let's say you already have tenderness, soreness, and mild damage to your nipples. What can you do about it? In the nipple world, from a cellular level, your nipple is different tissue than your skin. So for healing nipples, we actually want to use moist wound healing. We don't want to air out or air dry out your nipples. We want to use moist wound healing. This can be done with products like hydrogels. Hydrogels are a soothing, cooling, gel-like pad that goes right over your nipple to promote that moist wound healing. There's a lot of different brands out there that now make these hydrogels. Medela, kind of the old school brand for pumping and nursing supplies, makes them. Amida has them. Lancino and even Lactation Hub now have these cooling hydrogels. So what these are a water-based gel pad that's going to sit directly over your nipple to help promote that moist wound healing. Now, some people will actually take these pads and cut them down so that you can get more use out of them, but these can fit over the entire areola and nipple. These are great if you are sore or tender in those early days and weeks after delivery. They feel like a nice little cooling ice pack on the nipple. These can also work okay if you have mild cracking or nipple damage to, again, promote that moist wound healing. Now, every brand is slightly different in their pads. Lactation Hub says to reuse them only for up to 24 hours. The Lancino ones can be used for up to 72 hours. The reason why you don't want to perpetually use them is because they can promote breeding of bacteria. So we want to make sure that your nipple is healing and we're not introducing any other infection with that. So the research does show that these can work okay for tenderness and soreness, that anecdotally parents report that they did feel really comfortable. These can, per the research, also help promote moist wound healing. If you have moderate to severe damage, there are better wound care products out there to help promote the healing of your nipples. So if you are having anything beyond just something very simple, as in a very small crack, very small bleeding, tenderness and soreness, please see an IBCLC lactation consultant to make sure you have the right product, the right tool, and making sure we're getting to the root of why you're having that pain and damage. But overall, these products work great for those first couple weeks, and make sure that you read the manufacturer guidelines to know how long you can use them, if they are one-time disposable pads or if you can reuse them multiple times. If you do notice any sensitivity while using them, such as changes in your breast, redness, swelling, itching, other symptoms, please discontinue use for those. But hydrogels can work really well. Now you know.